Again, we're going to always start with your observation. What do you see? So when observing your patient, start at their base of support and scan up the body. You can go up and down. Just make sure you're taking in the entire person, especially when you're doing an activity. Sometimes that can be hard. You may use a mirror not for the patient to look at, but for you to be able to see the other side of the patient so you can guard and still observe and watch for their movement, watch for their breathing. So, I kind of have a checkoff list in my head. How is their breathing during this movement? Okay, then do it again. Let me see what their vision is like. Okay, now do it again. Do they have enough range to accomplish the goal? When they practice it, so maybe by that third time, because I'm checking off my list, do they get better? So do they change with practice? Or do they get worse because of their fatigue? Is that fatigue muscular fatigue or is it aerobic fatigue? Are they starting to get sweaty and they're starting to get short of breath? Also, do they change if I do add the mirror or if I add any kind of visual cue? Because then that's going to lead me more towards somatosensory. So overall, the biggest component I'm trying to emphasize is that every single piece of information that we observe tells us something more about our patient. So I'm referencing this handout, like lots of courses. I want you to just get in the habit. You can take it and turn it into something else, no problem. Just really reflect on how are you analyzing movement, because when we're talking about balance, like I mentioned in part 1, there's so many different reasons someone can lose their balance that we want to make sure that we're really being focused with our patients. Just some more thoughts. So when you're looking at them, what does their base of support look like? What are their feet doing? Where is their weight? Is it more on their forefoot? Is it more on their back of their heel? You're going to have to take their shoes off and see how are their feet responding to this movement. Are their toes clawing? Do they have some deformities in their toes and they're sticking up in the air? Then you're not going to be able to have as much. You might see a really extreme ankle strategy and be thinking, why do they have such an ankle strategy? And then when you take their shoes and socks off, you see that their toes aren't able to reach the ground. And so they're compensating for not having their toes to grab the floor with the ankle strategy. All of that goes back to the why. What's the timing? When they're using their ankle strategy, are we seeing a little bit more hip? Is it working itself proximal to distal instead of distal to proximal? Does the timing make sense with the strategy they're using? That might be more of a motor control problem. And it could have been something from the past. Maybe they injured themselves, when they were young or not so young. But no matter what, we're looking at all those pieces.